What about maintenance? So you gave them a brand new set of teeth. How do they take care of them?
It's like your natural set of teeth. You brush them twice a day. You use a water pick to clean the gums there, just like your natural set of teeth. That's what we're giving you. We're giving you a natural set of teeth that cleans like a natural set of teeth.
And they don't stain, is that right?
They don't stain. They're made out of zirconia. Zirconia is non-porous, so nothing attaches to it. It's a beautiful material. And then your maintenance is just like every 6 months. Every 6 months, you go to the dentist and you come for a cleaning. And that cleaning's no pain. You're not getting shots. You're not having bleeding gums. You're just having the prosthesis unscrewed and cleaned and polished outside the mouth and then put back in. So people are happy to come to the dentist. It's basically it's a conversation with the dental assistants, the hygienist, the dentist, saying, hi, what's up, how's life, figuring out what's going on in your life.
Now for these dental phobics, could they even get like a light sedation during this cleaning?
Absolutely. You know, I've had patients who even just to talk to me, they need a Valium. You know,
Is that
because
right?
I have a patient, yeah, because they've had so much anxiety from dentistry that they need that just to come in and talk for a consultation, or they need laughing gas. We make it work for you. Whatever you need, we make it work.